In this video, we'll review the basics of performing pure-tone air conduction audiometry and measure. To begin testing, select the Pure-Tone module on the left side of the screen. Note the measurement history displayed here. To base a new assessment off past results, you can select the desired record and click New Based On. To start fresh, select New Measurement followed by Pure-Tone Measurement. A dual view of the right and left ears is displayed in the hearing threshold level screen. You can switch to a combined or single view by using the drop-down menu located above your audiograms. You'll also find drop-down menus that adjust test type, step size, overlays, and uncomfortable loudness level limiter in this toolbar. You can also toggle extended range or high-frequency audiometry on and off here. On the right-hand side, you'll note your available test types, such as hearing threshold levels and bone conduction levels, and their corresponding symbols. You can change the current test by double-clicking the desired test type here. This can also be done using the drop-down menu at the bottom of the screen. At the bottom of your screen is your measurement controls panel. Above the panel is a space for note-taking. Simply double-click the text, type notes here to open the Edit Notes window. When a stimuli is being presented, the transducer drop-down menu will flash red. A patient response is indicated by a green flash of the entire measurement controls panel. To store a patient response, you can select Store. If no patient response is obtained, simply select No Response. On the left side of your screen, you'll find information about the current measurement, such as the current test being performed, the PTA, time of test, and transducer type. All this information is stored and displayed in your measurement history. With the measurement selected, you are able to perform actions such as showing or hiding, deleting or copying the curve to the opposite ear. Historical curves can also be copied to the current measurement. By selecting the trash can icon, all measurements will be deleted. In the Measurement Controls panel, you'll find options to adjust your current stimuli presentation, such as presentation side, intensity, and frequency. Transducer type for the presentation ear can be changed using the drop-down menu on the left-hand side. Below this, stimuli type, for example, pulse pure tones, can be changed. Below the measurement history is your assistant panel. Note, this information can be toggled on and off by editing your workflows. Here, the Measure software will alert providers to incomplete assessments and note the remaining steps needed to complete the exam. To the immediate right of this is where the masking transducer and stimuli can be selected and masking can be toggled on and off.